Hello everyone, this is Tracy and I am back to share another video with you. And for this video, I wanted to share with you some of the surgery prep and some of the things that I was using soon after the surgery when I came home. I know oftentimes women that are going in for surgery, whether it's lumpectomy, mastectomy, reconstruction, no reconstruction, are trying to figure out what's that list. What do I need to put together? What things do I need to consider? Things that you might not even think of. So I wanted to share some of that with you, and I actually brought them into my office here at home so I can actually show you those too, and kind of what helped me, what may not has been as helpful. It's going to be different in every situation. So the one thing I was glad about was that I did have a lot of different options. So I could pick and choose what I needed and not necessarily, figure out that something didn't work and not have any other options at the time. So I wanted to share some of that with you. It's going to be different in every situation, but just to tell you what worked for me and what my experience was. So in continuation from my last video, which was about my visit with my plastic surgeon, I did want to share that when I left out of my plastic surgeon visit, I had not made a decision yet. I mentioned in the previous video that it took me quite a few days after to really decide what to do because I didn't have my genetics testing back yet at that point. And so that afternoon when I left out of the plastic surgeon's office, I was very frustrated and upset because I realized that with cancer and what I was going through, what I was going to be going through as well, there's no quick solution. It's going to be, I'm in it for the long haul to do what I need to do to get back to or to find out what that new normal is. So I had thought that if I went forward with before I went in, that it was the lumpectomy, the radiation, I had a time frame, knew what it would look like, or that, maybe I could do direct to implants and be done, recover and go from there. But then with the realization that if I did the double mastectomy, that it would be several months out, just as much, if not more, than like the timing of the radiation from lumpectomy. It just kind of hit me that, this isn't a one and done, quick turnaround kind of thing. This is, it's going to change my life, and there's going to be things that I have to do, more than a few months out, even. So that was really hard. I ended up, I was going to take a couple hours off that afternoon to go to the plastic surgeon and then come back home and sign on to work on my laptop. I ended up texting the team that I'm on, and I said, I'm not signing in. Like, I was just, can't remember the word I used, but I was so frustrated. And I just needed some time to digest all of that information that I had gotten, and just the realization that, it's going to take some time. So just wanted to make sure that you're aware of that. I haven't been all smiles and happy. There's been so many tough times, frustration, anger, um, may not have cried through it all, but just that feeling and sitting with it. So I want to move on to share with you some of the things I had to prepare for surgery. So the first thing that I will share with you is I ended up packing up. This is my 31 bag that I got, and it seemed like it was the perfect size for what I needed. So this is the bag I actually took with me to the hospital. And I just have some leftover things sitting in here. A couple of things that I put in here that I'm not going to show you. Chapstick. People said sometimes your lips get really dry even after you come out of the surgery. So I had chapstick, and I had a couple pairs of socks because eventually so here's one thing that's left in here is these socks they put on in the hospital. And I have bigger feet, so these didn't fit very well. So I did make sure to bring a couple pair of like white athletic socks with me. I'm not going to show you this either, but I think I took like 2 or 3 pair of underwear, because when you go into the surgery and you do get ready for everything, you're not supposed to wear underwear. So I wanted to, for me, that's uncomfortable for me. Some people maybe not. So I packed a couple pair of underwear, which was really nice because when I was able to get up from my bed and go into the bathroom. It wasn't the first time, but I think the second time that I got up out of my bed the next or later that night, I wanted to put on a pair of underwear, just felt comfortable. So the nurse took them out of my bag for me. So I had that in there. So chapstick, I had the underwear, I had the socks. I also put in cough drops. I actually found they weren't like regular cough drops, they were like a watermelon flavored drop for your throat, because I heard and I had read that sometimes from having that tube in your throat, it could be really sore. And I know when I had surgery on my thyroid years ago, it was really, really painful when I woke up from that anesthesia and having that down my throat. So those would have been way helpful for that. I didn't have that feeling on this surgery, but I'm glad I had those just in case in my bag. Another thing I put in my bag was something to wear home from the hospital. In my case, I didn't really care what the hell I looked like when I walked out of that hospital. I had packed a pair of pajamas. I bought a short sleeve button down with pants, pajamas. So make sure when you are coming home, if you're going to wear out of the hospital what you wore into the hospital, it should definitely be a button down or a zip down, because you will have limited movement in your arms, more so maybe depending on how many lymph nodes you had taken out. But even if you don't have any, or if they only take out one or two, you'll be really sore, so you won't be wanting to put anything, over your head and try to get dressed that way. So that was definitely really beneficial. I did take a pair of slippers as well, and wore those out of the hospital instead of trying to get my tennis shoes on and tied or whatever. So whether they're slippers or some kind of slip-on shoes or something like that that you can wear out. The other thing, I'm trying to think, I did put in a robe. I never ended up using that at the hospital. I used it more when I came home a little bit later, a couple weeks later in my recovery. So I didn't need the robe. And I think that was it as far as my bag itself. Oh, one other thing I did put in my bag, and I used quite a bit in the first 2 weeks, is a friend of mine bought me this online, and it has pockets. So it's almost like if you're a waitress or whatnot. My husband said I look like I was ready to work at Waffle House. So this you just put on around your waist, and it has two pockets in it. And this was helpful for my drains. So when I came out, and just to remind you again, I had a double mastectomy with reconstruction with tissue expanders. My plastic surgeon had told me beforehand I would come out with drains. I would have 2 drains coming out from this side and then 2 on this side. And those, they had the long tubes. They were really long. And then at the end, it was probably about this big. It was like a bulb, plastic bulb, and it had a little plug on it. So with those drains, it was draining out. A lot of it at first was a deep red color, so any fluid. And I had asked, even later, I asked my plastic surgeon if the drains were like straight up this way, because I knew once they go in your body, they're like a really long, thin piece of plastic with like holes in it or something. And I asked if they went like up here, because when I came home, it wasn't my lymph node side, but it was my other side, and it hurt so bad right in here. Now I realize it wasn't from the drains, but when I talked to my plastic surgeon last week, and we were talking about the shape of my tissue expanders and everything, he thinks that there was a lot of scar tissue up here. So that was probably what that initial pain was. But the drains, actually, when they go into your body, so I have 2 scars. I think people call them vampire's teeth or snake bites or something. So 2 little scars right here. They had a stitch. They held your drains in. I'm thinking one went under, one went above, or maybe both went under. It was something like that. So it was more catching some of that fluid. And people can keep drains in. It all depends on, let me show you one other thing. So the hospital actually gave me the sheet, a couple of sheets. And what I was doing is they did it the first, the time that I was in the hospital. But I would have to, for each of those drains, record the date, the time, and the amount of the fluid. So I came home from the hospital with 4 little plastic cups that had the measuring lines on it in milliliters. I think it was, cc's. And you would have to write down how many cc's of the fluid. You would have to drain them 2 to 3 times a day. And then write down what your daily total was. So my husband and I would drain them twice a day, usually in the morning, a little bit after I got up and had my breakfast, and then later in the evening, like before we had dinner most of the time. One thing I didn't bring up here, but that was helpful for us, is when you go to drain them, what the nurse had said and the plastic surgeon had said is you have to, I think they called it stripping them, but you have those long tubes coming out and going down to that bulb. And what you need to do is, however high you can get up on those, like squeeze them, and push them down. So you might hold it from here and squeeze them and push it down so you get what's in that tube into the bulb. Sometimes what can happen is they can block, kind of clot up in the tubing. So you want to make sure that you have those cleaned out at least once a day or twice a day. We struggled. I couldn't do it myself in the beginning, and my husband was kind of having some trouble with squeezing it. I know, so some people had said on the groups that I was part of that they took like maybe a Lysol wipe or something and held it and squeezed it. I know there's other little contraptions you can buy. I think it's like on Amazon that you hook in and you put the 2 tubes like in between, and then you're able to take it and squeeze it. My husband came up with this idea. He brought out, it was like a little tiny roller. It had a handle and then the roller on the end. And it's for, I think it's for making ravioli or like pasta or something like that. So he basically took that. I stood up next to the counter and kind of put as close as I could, to the top part. And he took that roller onto the counter and squeezed that out into the tube. So we did that once a day. So that would get out as much fluid. It wouldn't let anything be blocked or anything like that. So we kept track of that. And the goal was for your daily total for each of those 4 drains to be at, I believe somebody said 20 to 25 or less for the day. So when I went to my plastic surgeon, I had my surgery on Thursday. I went the following Friday. So it was a week and a day. And my totals were pretty low. I want to say overall, I think they were about 20. I think that's right. I think they were around 20, maybe a little less than 20. He wanted to keep them in a little bit longer. So which I dreaded because the drains were painful. The most painful thing with the drain wasn't the stuff draining itself or the bulb itself. It was the piece that goes into, that's coming out where that stitch is, and making sure that, if you moved a certain way or whatnot, it could pull a little bit, and that was so painful. So I really liked this apron concept because I could take those drains, I could put them in these pockets, and I had extra tubing and I would put it in these pockets too. I was really afraid, I don't have children, but with my dogs, if my dogs were to jump up at all, that they would snag one. So that was really helpful to have that in here. The other thing that I use for my drains, in this, the hospital gave me this, but you can find these most places and find them on Amazon too, but it's a lanyard. So I would wear this. This is usually when I didn't have any guests or anything, but I would wear this, and the drains, for each of the drains, they had a little flap on them that had the number of what their drain were. So I would put 2 drains on one safety pin and put it up through here, and then I would wear it around my neck. So I'd end up having these 4 drains. Couldn't really wear a shirt. It would be like over top of what you were wearing, but if I had people coming over and it wasn't comfortable to put this on, sometimes I had trouble keeping this tied. It would be too loose around my waist and difficult when I went to the restroom or something like that. So this was helpful. And especially when I was able to start taking a shower with my drains on, this was really helpful because I could tag them on here, and then you're not wearing anything else, and be able to take a shower and use your hands as you could. I can say too, it was kind of like this when I was washing my hair. Another thing that I tried, I ended up not really caring for it, but I got rinseless shampoo. I was gonna get dry shampoo, but I've used that in the past and still felt icky after I used it. So I got this rinseless shampoo. So it's wet, and I sat in a chair and my husband put it on and he was cracking me up like a Muppet. And he was doing that. And then you take a towel and you kind of dry with a towel. So we did that, but I still felt even a couple, I mean, it probably took longer than the dry shampoo, but I still felt icky. I wash my hair every day, whether I should or not. So that was a really hard part for me to not be able to wash my hair. And sitting in a recliner, I didn't really like to put it up in a ponytail, nor could I do that myself. So I call myself the Hot Mess Express for the first 2 weeks as far as my hair is concerned. But this was really, really helpful. The other thing that was helpful too is once I had more movement in my arms and I decided to, and so even before I got into the shower, like sometimes I would want to weigh myself and that scale's right next to the shower. I would actually take this off and like hang it with my drains right on the shower rail, and I could step on the scale, so that wasn't included. The other thing that I would do is when I was in the shower, so after a while when I was getting better, I would actually take this off and hang it on the shower caddy that we had, and I was able to do things and those weren't really getting in my way. So this was really helpful. I know there's also something that a friend got me that actually came with this apron, was a net. It was kind of like a netted bag, I think, that you can hang around your neck. I don't think it was your waist. I think it was your neck, and put your drains in. I hadn't tried that. I ended up having a lot more luck with this. So I went back and forth between putting my drains on this and using the apron. And of course, when I went out in public, the apron was the most helpful. And I guess for me, it was good too that it was cold. So I was typically wearing a coat, or like my button downs would always end up covering what I had with the drains. So those were two really beneficial things. Also, when I came home, the hospital sent me home with these, but if you're not sent, if you don't end up getting sent home, these were helpful. So when you get your drains on or put in, you have a little stitch, and my doctor had put, it was like a little round thing that went around where the drain came out, and then it looked like saran wrap, like a sticker on it. When my plastic surgeon, I think it was a week, when I got to see him just over a week, and he told me that I could then take those off, and then if I wanted to put any kind of tape or anything on it to help it stay, the stitch helped it stay in, but anything to cover it up. And what I ended up doing was I took these, and you can take them, see how they're already pre-cut, and you can put them around where those drain tubes are. And then what I would do from there is, instead of using paper tape, so the hospital sent me home with a roll of paper tape, and that paper tape irritated my skin, and I felt like every time I moved, I could feel it. So I took these and I took athletic tape. So when we went to the store before my surgery, my husband and I bought this athletic tape, and it wasn't so sensitive on my skin. So I took this, and then I would put like one piece across here and one piece across here to kind of protect that drain and where that was coming out. And I would wear those in the shower, and then I could just change them out, you know, when I came out of the shower. So these were helpful too. I didn't have to wear them for too long because I didn't have my drain. I think I had my drains in maybe 2 weeks, maybe a little over 2 weeks. So those were helpful. The other thing is, and the hospital may send you home with some of these. It depends on what, I had somebody come in and kind of give me a care kit. These are kind of backwards probably when you're looking at it, gauze sponges, and they're 4" by 4". So they look like this, you can see through them. But the thing with these is I will take, and I'm still doing this I'm a little over 5 weeks out. I will take 2 of these, they're really, really thin, 2 together, and then 2 more together, and like this. And inside of the bra that I'm wearing, I'll put them between my skin and the bra. And that really helps with my, the stitches and kind of where they're healing. So even I said I'm a little over 5 weeks out, I'm still doing this, and I'll put those in between there to kind of be a barrier and a protection. And the other thing that I've used, and this is only in the last like week or two, is my husband bought the wrong size of these. They're almost like the same material, this padding for these, but bought small. They're 2x2, and bought these for me. I didn't think I'd have a use for them. I ended up using them just temporarily for a little bit. And what I use them for is when my stitches, it's healing now and it's scabbing, and some of that scabbing falls off. Well, just in the last, I think it was the week and a half or 2 weeks ago, there was a big chunk that fell off. Sorry if this is gross, but a big chunk of scab that fell off. And so it felt like there was a little bit of exposed skin there. And I was a little afraid because this was snagging some of that. And so what I did was I'm not going to take one of those out, but I took, if I do this for you. So say this was, the size of it. When I wore these in, I would actually take this piece and I put it against my skin where that exposed skin was, and put this on top of it and kind of put that in place to protect. I didn't want this to pull it, if I moved in a certain way or whatnot, or as I went to take it off later. So I put this on it. There wasn't really anything soaking up on this, but doing that for a few days made me feel a little bit better, that it was more protected. And when I went to my plastic surgeon just this last time, I even asked him, I said, that is showing, it feels like it's a little exposed. Is that okay? And he had no concerns with it. He wasn't worried about what it was looking like. He said it was healing properly, but this was kind of like a peace of mind for me. So I end up using, I don't use this anymore. It's kind of fine. It's healed a lot better. But like I said, I take, so it's 4 total for each side and wear that. And this, it's a pack of 200 sponges. They're 4" by 4". These were just under $5 on Amazon. So it's Medline is the company. It's non-sterile gauze sponges. These gauze pads that were 2x2, they were just under $5, and there's 24 pads in a pack. So just some ideas if you want to prepare and what you might need afterwards. Always better to have things than not. And you can always give them to other people or whatnot if you don't end up using them, and keep them packaged. So a couple other things I want to talk about are pillows. And I'm going to pause a minute and go grab one additional pillow so I can show it to you also. Okay, I'm back. So I want to show you a few pillows. What's been helpful and not helpful for me since I came home from surgery. So when you are coming home from surgery, you will want some kind of pillow that you can wear in between the seatbelt and your chest when you're coming home, so that it's not tight around your chest. So a friend ended up buying me, thankfully, this one, a mastectomy pillow. You'll find this is on Amazon. And there's even a spot in it, so if you put an ice pack, if you need it. But basically, I got in the car, this goes under my arms, and then I put the seatbelt on top of it. When I came home from the hospital, I used this quite a bit also as I was sitting in the recliner because of my dogs. I was afraid if my dogs tried to jump up, and it was a helpful barrier to have against me. I haven't used it. So I used it the first few times I had to drive in the car to like doctor's appointments and stuff. Not me driving, my husband driving. Since then, I've kept this in my bed at night. So I would say for the last 5 weeks now, for the last 2 weeks or so, this has been in my bed. When I first transitioned to my bed, I would keep it on my chest and I had to lay on my back. So I keep it on my chest just in case the dogs tried to jump up. Now what I do is I actually take it and I will lay it on my left side. I have 2 pillows behind me, regular pillows, 2 pillows next to me. I used to have one underneath my knees, but I put it next to me. My lymph node side is my right side. So this, every once in a while, I can kind of lay on it and lay a little bit on my side without feeling too much pain, but I don't lay the whole night like that. So it's a nice buffer to have there on my side to lay on. So that's how I've been using this one. The other one that I bought, and this was, I want to say it was like $35 or so. I think the other one was just over $30. I've gotten a lot of use out of that, like I mentioned, in different ways. This one is the wedge pillow. And initially, before my surgery, I would sleep on my stomach or on my side. And now post-surgery, I've had to sleep on my back for the most part. Sleeping on my side can hurt my expander a little bit. I'll feel sore the next day. Trying to use this wedge pillow has not worked for me. May work for you. The angling, there's something about the angling that just has not been comfortable. I don't know if it's too much of a structure and a certain angle, whatever it was. So this has not really been extremely helpful for me. So I don't really use it that much. I tried it on the couch, I tried it in bed, and it hasn't. The pillow that has been the lifesaver for me and that has been the most helpful is this. It's a little, and it actually, I realized it has a little pocket. Yeah, has a little pocket in it too. So if you needed an ice pack, you can lay it on there. This pillow I actually got from the hospital, and it was made, so it says made for you by the Riverside Sewing Guild. The hospital gave me this with my care package. Can't guarantee you in your situation that this will happen, but this, I even let the nurse, when she called me even just a week ago to see how I was doing, let her know the value of this. So this, what I've done is when I came home, it was helpful because I would either lay it sideways and be able to prop up my arm, because you're supposed to put your arm, especially the lymph node side, put it up so that you have less cause for swelling and eventual lymphedema. So I was able to prop it up either this way, or I would set it on the chair like this and prop it up. It was also helpful too because when I would do an ice pack under my arm, and after I had my drains out, I had a little bit of swelling and still do under this arm. I can take the ice pack that I use and drape it over it and put a towel and kind of lean on it like this. So I use this still every day when I'm sitting in the recliner or on the couch. The other place I use this is I no longer use that big, huge mastectomy pillow in the car, but I use this. So I go in the car, I put this in front of me, and I told my husband, I said, it's like I'm holding like a little baby. But I put this in front of me, and then I strap the seatbelt around me. What I also got, I haven't found it extremely useful yet, but I think it's because I'm not far enough along in my recovery, is a seatbelt protector, and it's probably about this big. It's in my car, and it's a fluffy, and it kind of folds over and velcros onto your seatbelt to kind of protect your chest. So when I tried to drive, it was maybe a week and a half ago or so, I did a short run up to the main street that we're on. There's a gas station there. So I did a run to see how well I could drive. A difficulty that I had was that wasn't enough cushion on my chest from the seatbelt. So it hurt. And the other thing is my right arm from my lymph nodes taken out, couldn't stretch far enough. So I could put it like rest on the bottom of the steering wheel, but I couldn't really reach, with both hands to the steering wheel. What I've done since then is I actually had the opportunity just a couple of days ago, maybe it was yesterday or 2 days ago, to try to drive again. I wanted to try to drive again, and I took this instead. So I had a friend who was also a survivor, and she's like, you might need more cushion, take a pillow or something else. So I took this, put it in here, put the seatbelt on. I scooted my seat up a little bit in the car just because of the hand thing. I have much more functionality in my arm now. There's still some pain like right in here, but not so much in here other than from the swelling on the side. So I was able to put this here, put the seatbelt on, and do a much better driving. It did hurt a little bit afterwards, but it was much more comfortable to have this and to be able to drive with this. It had much more cushion. So whether you have something like this, somebody can make one for you, you could find one, or even if you needed to use like a small pillow or something like that. This has really been a godsend. It's been really helpful. So those are really the big things that I've used. The other big thing is when you come home from the hospital, make sure you have a lot of zip down items. So I got some, they're jackets with pockets. They're very, very comfortable. I got a couple different colors from Meyer that we have here in Ohio. I also got a couple of like flannel button down that I could wear. At this point now that I am 5 weeks, probably about a week ago, I was able to start putting overhead shirts on, put them over my head, but I would have to take this arm, put it on, and then able to stretch more with this arm. So there's still, limits to the functionality, but I'm able to put those shirts on. So those are items that were extremely helpful for me, both going into the hospital and coming home. So I hope that helps you in thinking about and evaluating what you might need, or if you are thinking of helping somebody else who goes through this, whether it's lumpectomy, mastectomy, anything, reconstruction or not, hopefully those are some items that will be helpful to you. Another thing, a friend gave me a little tiny thing of hand sanitizer, so I put that in my bag. I think that was it. Hopefully I'm not missing anything. I think that was the majority of. Oh, another thing to make sure that they take to the hospital too is an extra large or extra long phone cord charger and the little thing to go in the outlet. My husband actually had a charger that looks almost like a cell phone itself, but a charger block, and he had that all charged up so I could just put the long cell phone cord in it and charge my phone, and that sat right on the table next to me in the hospital. So that was really, really helpful to have there. So I think those are the big things that I can think of from what I used, what was beneficial, what was not so beneficial. And I will leave it there. The next video I'm going to do, I'm going to talk a little bit more about post-surgery bras and the different things that I've tried that have worked, that haven't worked, that kind of thing. So thanks for listening, and I'll talk to you later.